We have discussed of the large core population, which is a population of clearly, perfusion imaging and EVT probably have a big role to improve patient outcome. So perfusion imaging typically is a very useful tool, I guess, in this population. But there are other situations for which endovascular therapy is not proven so far. For example, there is the medium vessel occlusion. For example, the patient with more distal occlusion, such patient with M2 occlusion, with patient with posterior cerebral artery occlusion, or with anterior cerebral artery occlusion. And in this situation, we don't know from the randomized trial if there is any benefit or not from endovascular therapy. And also, very importantly, we know that from observational studies that the prevalence of mismatch in this population with more distal occlusion, the prevalence of mismatch is much lower than in a patient with more proximal occlusion. There is roughly 80% of patients with a mismatch and 20% of patients without mismatch. And there is some recent publication from mostly retrospective studies that have shown that only the patient with a mismatch seem to have a favorable outcome following endovascular treatment as compared to medical management. And on the opposite, the patient without mismatch do not seem to have any benefit from endovascular treatment and even seems to derive some harm from endovascular treatment. So clearly, I guess that treating all these patients with EVT is not the way forward. We should select the good patient for the good treatment in the particular situation, such as medium vessel occlusion, large core patient, and that's the same for large vessel occlusion with minor symptoms, which is also another situation where typically the role of perfusion imaging probably is extremely important.